Here's something you probably won't hear in a doctor's office in La Jolla.
Because he seemed to think that me getting kicked by the calf caused the
The blood clot?
Nurse practitioner Carol Lieber has heard this kind of thing before. She works in the East County town of Campo, where being kicked by a calf or cut by a chainsaw are routine complaints.
But I think the thing that gives me the adrenaline, which I'm not necessarily an adrenaline junkie by any means, is never knowing who's going to walk in the door and what they're going to need.
The community health center in Campo sits in a double-wide trailer. Other than Indian Health Services on the Campo Indian Reservation, it's the only place to get care in an area that spreads over 950 square miles. A doctor comes here once a week. Otherwise, for 16 rural communities, Lieber is it.
Knock, knock. Some of the worst case scenarios we'll see are patients that are on medications that need a high level of monitoring, and they live down a 5-mile dirt road. They have no transportation, spotty cell phone service, and they can't necessarily get back in here on a regular basis.
That's when Omar Acevedo comes to the rescue. 5 days a week, he picks up patients and brings them into the clinic.
I got a client way back on the mountains. I drive like for 15 minutes on the road. I'm like, okay, I'll get there someday.
The nonprofit Mountain Health operates community clinics in San Diego, Escondido, and Alpine. In contrast to those well-equipped facilities, the Campo Clinic doesn't have its own lab or x-ray machine. And the closest hospital? Grossmont in La Mesa, about an hour's drive from here. You can forget about specialists in this part of San Diego County, but mental health care is available through the clinic's telemedicine service.
This is the device that does it. We have the patient at one end, and then we have the provider, whether they're a psychologist or psychiatrist, at the other end, and they can talk essentially face to face, and it works really, really well.
Some people live in Campo for the wide open spaces, but others move here because they can't afford to live in San Diego. As it turns out, there's a lot of poverty in this area. That's why Mountain Health goes beyond the call of duty and provides hot meals to local seniors in need. Staff prepare the food from scratch. They cook up 150 meals 3 times a week. For people who can't make it into the community center to eat, drivers will take the food to them. Coordinator Esther Matos says some of their clients live in isolation.
So the driver that we send out there is probably the only person that they will see for a while. So we actually take a lot of pride on that, and we actually get to socialize and they get to spend a lot of time with them.
Mountain Health CEO Judith Chaplin grew up in this area, and for as long as she can remember, people have been clamoring for more medical services. They're finally going to get them. Mountain Health is getting ready to build a 2-story medical complex that will offer a wide array of services, including the region's first dental clinic. The complex will cost $9.8 million. Chaplin says they've secured most of the funding through federal grants and loans. They'll have to hit up donors for the rest. Chaplin says it's taken decades of hustling, planning, and fundraising to make the health center a reality.
And it's an amazing experience to see a vision and a dream that the community had that I personally embraced because I was a member of this community, and then to see it actually happening. It truly is a dream come true for us.
The new clinic represents a major upgrade for rural health care in San Diego County. It should be open for business by the end of 2016. Kenny Goldberg, KPBS News.
said he thought it was